mind that could have been prevented. So preventable vision loss, we are looking at a global burden of 1 billion people. When we look at the global burden of retinal conditions, it stands at 300 million. Again, a staggering number. Loss of sight can have a wide range. It's being riddled with challenges, I would say. There is a late presentation of symptoms. Again, to add to the issue, there is late diagnosis, there are treatment gaps, and there is poor adherence. And
so it is the package that you need to look at, and for that, my request is across the 5 centers, post this central Q&A. We can always take this question, the SCPs can answer, because it is not a 1 unit cost that you're paying. You're paying the cost for the treatment outcome that is depending on your clinical condition and the diagnosis that the clinician does, as what Dr. Khatri explained. So we will take this question, I will be more specific, but yeah. Okay.
Okay, there is number of instances.
So for this particular condition where we're looking at DME and we're looking at AMD, even a medical retina specialist can more or less handle the treatment of these patients because it does not involve surgical intervention. So yes, like Dr. Khatri mentioned, we have a society in the country called as the Vitreoretina Society of India, wherein all the retina specialists meet and we discuss and deliberate about the best treatment option for our patients. But beyond that, there is a society called as the All India Ophthalmic Society, and a lot of these doctors across the country are equipped with the expertise to handle this particular condition. So yes, access is there, but unfortunately the patients don't have that behavior of seeking healthcare simply because they don't know. That is the challenge here, not the expertise or the human resources. I think in India, our healthcare is at least in ophthalmology on par with the rest of the world, in fact. I'm not sure if that answers your question, but the access should be made more and the awareness should be made more. The expertise is there, on par.
Thank you. And treating retinal disease. So I think the question that's broadly coming out is, while there is a responsibility from the patient side, I think there is a barrier in terms of how does early diagnosis and awareness happen. Any thoughts there?
So I think that's a very important question simply because we are not the first caregivers for these patients. Whether, especially with diabetics, the first or the primary caregiver is the diabetologist or the physician. So unless a physician can emphasize the side effects or the complications of diabetes, be it retinal, be it nephropathy or kidney related or neuropathy, the patient does not go subsequently. Now we have centers which have all specialities. Now if you go to Kannada Institute of Diabetology in Bangalore, they have a specialist who will screen for the retina, for the nephrology, the kidney issues, and for overall health as well. Whereas if you go to a private practitioner or a single diabetologist, they may not actually be referring the patient for an annual screening. All we are asking is, at the time of diagnosis, send the patient once so that we can create the requirement for regular follow-up. That is unfortunately not happening. We as a society from Vitreoretina have been trying to involve physicians, diabetologists. We've been having constant meetings in different centers in India to encourage the physicians and the diabetologists to involve retinologists in the treatment of these patients. That is our biggest challenge. Because many a time, Dr. Natarajan mentioned about 35 years of age. I am seeing diabetics who are even as young as 22, 25, 30 years of age who are coming with advanced disease. Irrespective of whatever treatment or surgery that we offer them, their vision can never be restored to normal, and they're real young diabetics who have 40, 50 years ahead of them.
Thank you.
ಚೈತ್ರ ಜಯದೇವ್, ನಾರಾಯಣ ನೇತ್ರದಲ್ಲಿ ರೆಟಿನಾ ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತೀನಿ. ಸೊ ಇವತ್ತು ನಾವು ವೆಬಿಸ್ಮೋ ಅಂತ ಪ್ರಾಡಕ್ಟ್ ಬಗ್ಗೆ ಲಾಂಚ್ ಮಾಡಿದ್ವಿ. ದಿಸ್ ಇಸ್ ಬೈ ದ ಕಂಪ್ನಿ ರಾಶ್. ಸೊ ಈ ಪರ್ಟಿಕ್ಯುಲರ್ ಪ್ರಾಡಕ್ಟ್ ಡಯಾಬಿಟಿಕ್ ಮ್ಯಾಕ್ಯುಲರ್ ಎಡಿಮಾ ಆ್ಯಂಡ್ ಏಜ್ ರಿಲೇಟೆಡ್ ಮ್ಯಾಕ್ಯುಲರ್ ಡಿಜೆನರೇಷನ್ ಅಂತ 2 ಕಾಯಿಲೆಗೆ ಟ್ರೀಟ್ಮೆಂಟು. ಇಲ್ಲಿವರೆಗೂ ನಾವು ಸುಮಾರು ಇಂಜೆಕ್ಷನ್ಸ್ ಇತ್ತು ನಮ್ಮ ಕಡೆಯಲ್ಲಿ, ಅದಕ್ಕೆ ಆ್ಯಂಟಿ ವೆಜೆಫ್ ಇಂಜೆಕ್ಷನ್ಸ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ನರದ ಸೆಂಟರ್ ಅಥವಾ ಮ್ಯಾಕ್ಯುಲ್ ಅಲ್ಲಿ ಆಗೋಂಥ ಪ್ರಾಬ್ಲಮ್ ಇದು. ನರ ಊತ ಆದಾಗ, ನರದಲ್ಲಿ ನೀರು ಸೇರ್ಕೊಂಡಾದಾಗ ಪೇಷಂಟಿಗೆ ಸೆಂಟ್ರಲ್ ವಿಷನ್ ಅಂದರೆ ಮುಖಗಳು ಕಾಣೋದಿಲ್ಲ, ಮೊಬೈಲ್ ಕಾಣೋದಿಲ್ಲ, ಆ ಪ್ರಾಬ್ಲಮ್ ಆದಾಗ ಕೊಡೋಂಥ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದು. ಕಣ್ಣೊಳಗಡೆ ಕೊಡೋಂಥ ಇಂಜೆಕ್ಷನ್ ಇದು. ಸೊ ಇದು ಪರ್ಟಿಕ್ಯುಲರ್ ಪ್ರಾಡಕ್ಟ್ ವೆಬೈಸ್ಮೋಲ್ ಏನು ಅಡ್ವಾಂಟೇಜ್ ಇದೆ ಅಂದರೆ ಇಟ್ ಇಸ್ ಗಾಟ್ ಅ ಡ್ಯೂಲ್ ಮೋಡ್ ಆಫ್ ಆ್ಯಕ್ಷನ್. ಅಂದರೆ 2 ಟಾರ್ಗೆಟ್ಸ್ ಇದೆ ಈ ಪರ್ಟಿಕ್ಯುಲರ್ ಡ್ರಗ್ಗಲ್ಲಿ. ಅದರಿಂದ ಏನಾಗುತ್ತೆ ದರ್ ಇಸ್ ಫಾಸ್ಟರ್ ಡ್ರೈಯಿಂಗ್, ಅಂದರೆ ನರ ಊತ ಬೇಗ ಕಮ್ಮಿ ಆಗುತ್ತೆ ಆ್ಯಂಡ್ ಅದು ನರದ್ದು ಡ್ರೈನೆಸ್ ಇನ್ನೂ ಜಾಸ್ತಿ ಡ್ಯೂರೇಷನ್ವರೆಗೂ ಇರುತ್ತೆ. ಸೊ ಪ್ರತಿ ತಿಂಗಳು ಕೊಡೋದು ಬದಲು ಅಟ್ಲೀಸ್ಟ್ ಒನ್ಸ್ ಇನ್ 4 months, ಒನ್ಸ್ ಇನ್ 6 months ಕೊಡೋ ಅಂಥ ಅಡ್ವಾಂಟೇಜ್ ಇದೆ. ಬಟ್ ಈ ಟ್ರೀಟ್ಮೆಂಟಲ್ಲಿ ಚಾಲೆಂಜಸ್ ಏನು ಬರುತ್ತೆ ನಮ್ಮ ಪೇಷಂಟ್ಸ್ಗೆ, ಒಂದು ಅಂದರೆ ಅಫೋರ್ಡಬಿಲಿಟಿ. ಸೊ ಇಂಡಿಯಾಲಿ ಇಟ್ ಇಸ್ ಡಿಫಿಕಲ್ಟ್ ಟು ಅಫೋರ್ಡ್ ಟ್ರೀಟ್ಮೆಂಟ್. ಎವ್ರಿ ತಿಂಗಳು ಬಂದು ಸ್ಕ್ಯಾನ್ ಮಾಡ್ಕೋ ಪೇಷಂಟ್ಸ್ಗೆ ಇಂಜೆಕ್ಷನ್ ಕೊಡಬೇಕು ಅಂದರೆ ಕಷ್ಟ ಆಗುತ್ತೆ. ಆ್ಯಂಡ್ ಅದ್ರ ಮೇಲೆ ಇನ್ಶೂರೆನ್ಸ್ ಕೂಡ, ಬಿಕಾಸ್ ಇಟ್ಸ್ ಅ ಡೇ ಕೇರ್ ಪ್ರೊಸೀಜರ್, ಪ್ರತಿ ಸತಿ ಅದು ಕ್ಲಿಯರ್ ಆಗೋದಿಲ್ಲ. ಪೇಷಂಟ್ಸ್ಗೆ ಇನ್ಶೂರೆನ್ಸ್ ಇದ್ದರೂ ಅದು ರಿಜೆಕ್ಟ್ ಆಗ್ತಾ ಇರುತ್ತೆ. ಸೊ ಆಲ್ ದೀಸ್ ಚಾಲೆಂಜಸ್ ಇಟ್ಕೊಂಡು ವೆನ್ ವಿ ಹ್ಯಾವ್ ಅ ಮಾಲಿಕ್ಯೂಲ್ ವಿಚ್ ವಿಲ್ ಗಿವ್ ಅಸ್ ಲಾಂಗರ್ ಡ್ಯೂರೇಷನ್ ಆಫ್ ಆ್ಯಕ್ಷನ್, it is definitely going to be helpful for our patients.